I'm Aparna Riknatharan, Occupational Therapist working at the Dimension Center for Child Development.
Hello everyone, I am Sindhusha Saravanan, Occupational Therapist working at Dimension Center for Child Development. And as we all know that every year on October 27 we'll be celebrating Occupational Therapy Day. For this year we would like to discuss how occupational therapists can help a child with autism. So first let's start how OT can help the autistic child.
So mainly we are focusing on gross motor skills. I'll explain one by one. The gross motor skill means usually you know that child will achieve walking by one year or 1.5 years. Like that we have many more gross motor skills. For example, skipping, jumping, one leg standing, like this. This all come under gross motor skills. So maybe the child may get delayed for achieving this. In this part will help the child to achieve these things at their maximum functionality. And next one is like fine motor skills. Fine motor skills, you can get an example of buttoning skills, zipping, like the small, what all things using with hands and doing, that all comes under fine motor skills. So in these areas also sometimes a child get delayed, and the other part is like ADL skills. For ADL, as you know, like every activities we are doing in the daily life, it's called ADL. For example, brushing, gardening, reading, cooking, everything comes under ADL. And the other part is handwriting. Usually the child with autism or without autistic, children without autism also, they have issue with handwriting. Will help the child to improve their handwriting, the pencil grasp skills and pre-writing skills. It all working on these areas. And also maybe for the higher functioning autism, we have to focus on their vocational training also. And the major concern of autism kids may be the sensory issues. So we are working for the sensory issues also. Let's see what all the sensory issues we are working for autistic children.
Yeah. So as ma'am told, like all the developmental milestones will be working along with the sensory issues. So first let me tell about what are the senses that we all is going through as in daily life. So there is 5 major senses, which is like auditory, gustatory, tactile, olfactory, visual skills. So apart from these 5 senses, we also have proprioceptive and vestibular senses. So these are all the senses we'll all be going through in our daily life. As an autistic kids, they'll be having issues like some of the senses they'll be having like hypersensitivity and hypersensitivity. So hypersensitivity is like they won't be able to like take in more senses. For example, if they are in the bright light, they won't be able to take it in and they'll show some tantrums behaviors. So like that. In the same way, when there is a smell, a strong smell is coming, they won't be able to take in. So these are the skills the child will be like in hypersensitive. So hyposensitive in the sense the child won't be giving a response for a particular senses. For example, they need more of auditory stimuli to get response from the child. For example, if you ask a child like what is your name? So a normal kid, so as a typically developing kid, they'll be answering in for the question in the same attempt. But when the child has some hyposensitivity, they need some more commands. For example, we have to ask them like 2 or 3 times, what is your name, what is your name, or can you get that one from one place. So like that we have to give more stimuli for them to take a response. So this is what is hyposensitive. So the features will be like in each sensory basis, they can be like hypo and hyper in a same child. So for example, the child can be hypersensitivity to auditory and hyposensitivity to proprioceptive. These are the things will the basic sensory concerns the parents can see in a day-to-day life. Now let's see how OTs can help with these issues.
Yeah, initially you know that these are the sensory issues, hyper, that and all Sindhusha ma'am explained. So once the kid come to us with these issues, we'll go for an evaluation. We have a standardized evaluation for that. We'll check for which level the child comes under which level we'll check it for it. And after that we'll make a plan for the kid. Maybe if it is hyper or hypo, we'll plan some activities. Maybe you will come across this activity. I'll give you some examples of sensory integration therapy. Maybe you'll come across neutral warmth, joint compression, maybe swinging, ball bouncing. These all are some of the activities we using for sensory integration. Now you know what are sensory issues, what are the therapies. Then let's check what all the things we have to look out for the red flags of autism. Maybe ma'am can help us.
Yeah. So yes, these are all the things we have explained. So how the child will be have delay in the motor skills, as well as sensory issues, and how we can help out with that. So first, primary thing is, what are the things the parents should look out if the child is developing. For example, the child is 18-month-old, 12-month-old. So what the parents can look for it. So that's, we call it as red flag. So if the things I'm going to list out, if you see the things that is happening with the child, you can actually help, call out for the professionals' help. So I'll go with the 5 things. I'm going to explain 5 red flags. The first one is delayed motor skills. As we all know that a child should sit in 6 to 7 months independently, and he or she has to stand 8 to 9 months independently, and he or she should start walking independently in their 13 to 14 months, by their first birthday they have to stand and take their first step. This is what is all the milestones will be saying. So if you see any motor milestone delay, so that is a one of red flag. And the other thing is delayed communication. So same motor milestones will be having the child has to put babbling 3 to 4 months, and he or she should start a word, one word with 1 year, which is in their first birthday. Usually we will say it as they'll be putting their words, and before that 8 to 9 months, 10 to 11 months, they'll be putting their monosyllables ta, ma. So this and all, they'll be actually the typically developing has to achieve. So when you see there is a delay, so still my child is 1.5 years, but he or she is not putting their first word, so these will come under one of the red flag. The other thing is stereotypical behaviors. So let me explain you what is stereotypical behavior. So the thing is, what we can see from a parent perspective, if the child is whatever the toys, if you give them, they'll be lining up in a straight vertical line, or in they'll be line stacking it one another. So usually it is a non-functional way of playing. So what if you give some toys, they have to play it functionally. For example, if it is a rattle, they have to make some noise and enjoy with it. But this child prefers to make it in a line or stack it up in a line. So these are all some of the stereotypical behaviors. What other I can give you example is they'll be always switching on and off the lights, so which is non-functional. So simply they'll be doing that one. Or else they'll spin the objects and see how it is rotating. For example, the child can take a car, and then they'll be just moving the car to see how the wheels are rotating. So these are some of the stereotypical behaviors parents can come across in a daily life. The fourth one is the child will always prefers to play alone. We'll say it as a solitary play. They won't if 1.5 to 2 years, no, the kids has to interact with the peer group, and then interact with the persons in and around the homes, relatives or the neighborhood. So this is a typically developing children will do. But these kids, they always prefers to play alone with their favorite toy. That too, they won't explore many toys. So whichever is favorite for them, they'll be playing with that only one toy. Or they'll be only comfortable with only one person. That may be caretaker, mother, father, or grandfather, grandmother, like that. So they'll always prefer to play alone, a solitary play. The other thing is social and emotional skill. For example, they won't give eye contact when we are speaking to them, and then they won't respond to their name. They won't give us the social smile. So these are some of the social emotional skills parents can look out for it. So when as a parent, when you are looking these red flags in your child, so please make a concern, and you can call out for the professional help. So now let us know whether OT will work only with the autistic child, or OT has any other areas to help with.
We are not working only with ASD kids. We have In pediatrics, we are also working with genetic disorders, and we discussed here, like we have, maybe child may have delays in gross motor, fine motor, like developmental delays. We are helping child to achieve their age adequate motor milestones, and also we are helping them out in some genetic conditions also. For example, some Down syndrome, muscular dystrophy kind of genetic disorders also we are helping. And also we are helping for other neurodevelopmental disorders. Not only we are working in pediatrics, we have some roles in psychiatry, neuro, ortho and oncology also.
So let's hope this video helps you to find what is occupational therapy and how a child can help from occupational therapy. We hope it's a helpful video for all of you who are watching. If you find it's helpful, you can share and comment.